think, and that's a really great question. And I love that we're seeing the consumer partnership emerging, and it's a lot stronger, I would say, in the last 5 years than it has been previously, which is fantastic. But I guess engaging consumers early on, so in that design phase, is really important, and seeing the consumer as a partner rather than an optional addition or something that we need to do as part of a tick box process. And I say that with all due respect, but I do see that as a consumer in different areas and also as a clinician. So really thinking about how you co-design with a consumer is really important. Timely communication, being very clear on what you want from the consumer is so important. And like you would treat any member of the team. So I often say to clinicians and teams, treat your person with lived experience, your clinician, as someone that is as valuable as your other team members. We want to know why and what. So essentially, why is your research, why is your project so important? How is this going to improve the patient cohort that I represent? So how is this going to improve the health, the clinical outcomes, the patient journey? How is this going to help our patient population? And keeping in mind that the person with lived experience or the consumer can also be a carer or a loved one. It's not always the person involved. And that's quite important because we do get different perspectives from the person with lived experience and from the carer or the loved one as well. I guess those are the main sorts of things, making sure that your call to action is really clear. What do you want from us? How can we best support you? And tapping into the platform like we've talked about with Cancer Voices Australia, because then you can ask for particular, I guess, qualities or experience in a consumer, and that's quite important. I'm really fortunate enough that through my online platform work that I am doing now and that I've done previously, I've been able to connect with a whole range of cancer patients from across the country. So I know the types of questions and the types of issues and gaps that those patients are experiencing and facing. So if you want a breadth of experience, do put that in your proposal request. Don't be afraid to ask, because people will have different ideas. And if you are looking at an intervention, of course, that involves an older age group, then you do want to have a consumer that has that experience. Equally, the younger patients or mothers or fathers, just be very clear on what it is that you need.
Thank you, Sally. I think that's really terrific advice, in terms of involving early, making sure that the lived experience person is really a part of your team, just as a valued member of the research team, just like anyone else, and treated as such.